Schizophrenia, a word that's often whispered, misunderstood, or used incorrectly. Movies and media have painted a distorted picture of what it really means to live with schizophrenia. But behind the stigma lies a deeply human story, one of confusion, courage, and the constant search for clarity in a world that sometimes feels split between what's real and what's imagined. In this video, we're going to explore everything you need to know about schizophrenia, from symptoms and causes to how it's diagnosed, treated, and experienced day to day. By the end, you'll understand that this condition isn't about being crazy. It's about the complex ways the mind can work, and how compassion, awareness, and treatment can bring balance back into someone's life. Schizophrenia is a chronic and serious mental health disorder that affects how a person thinks, feels, and behaves. It often involves difficulty distinguishing between what's real and what's not. People may experience hallucinations, delusions, or disorganized thinking, but it's not the same for everyone. Despite common myths, schizophrenia does not mean someone has multiple personalities. That's an entirely different disorder called dissociative identity disorder. Instead, schizophrenia affects how the brain processes information and reality itself. It's like a radio that sometimes loses signal. The station is still there, but the static distorts the message. Schizophrenia symptoms are typically divided into three main categories. 1. Positive symptoms. These are added experiences that aren't normally present. Hallucinations, hearing, seeing, or feeling things that aren't actually there, most often hearing voices. Delusions, strong beliefs that aren't based in reality. For example, believing someone is spying on you, or that you have special powers. Disorganized speech or thinking, jumping from topic to topic, using words that don't connect, or difficulty staying on one thought. 1. Negative symptoms. These are losses of normal function, lack of emotion or facial expression, reduced speech, loss of motivation or interest, social withdrawal or isolation. 1. Cognitive symptoms. These affect thinking and focus. Trouble concentrating, memory problems, difficulty making decisions or understanding information. It's important to remember, symptoms can appear gradually. Early signs may look like anxiety, isolation, or confusion, often mistaken for other issues before a full diagnosis is made. For someone living with schizophrenia, daily life can feel unpredictable. Imagine hearing a voice that isn't there, not a faint whisper, but as real as someone sitting next to you. Or feeling certain that strangers are watching you, even when you logically know it's unlikely. The world becomes a puzzle, and every piece feels out of place. Many describe it as a constant battle between trusting their own senses and trying to anchor themselves in reality. It can be isolating, confusing, and exhausting, but it's not hopeless, because with treatment and support, symptoms can be managed, and people can live full, meaningful lives. The exact cause of schizophrenia is still being studied, but it's believed to come from a mix of biological, genetic, and environmental factors. Genetics. Having a close relative with schizophrenia increases risk, but no single gene causes it. Brain chemistry. Imbalances in neurotransmitters like dopamine and glutamate affect how messages are sent in the brain. Brain structure. Some people with schizophrenia have subtle differences in brain size or connections. Environmental triggers. High stress, trauma, prenatal complications, or drug use, especially during adolescence, can trigger symptoms in someone who's already vulnerable. So while it has a biological foundation, life experiences can influence when or how symptoms appear. Schizophrenia is diagnosed by mental health professionals, usually psychiatrists, through careful evaluation. There's no blood test or scan that can confirm it. Instead, doctors look at a combination of symptoms, duration, and impact on daily life. Symptoms usually have to last at least 6 months, with at least 1 month of active psychotic experiences, like hallucinations or delusions. Schizophrenia is treatable, not curable yet, but manageable with the right support. Medication. Antipsychotic medications help balance brain chemicals and reduce hallucinations and delusions. Therapy. Cognitive behavioral therapy, CBT, social skills training, and supportive psychotherapy help people navigate everyday challenges. Community support. Housing, vocational training, and peer programs make an enormous difference. Family education. When loved ones understand schizophrenia, they can help reduce stress and provide healthy, stable support. Consistency is key. When treatment is followed, many people can maintain jobs, relationships, and independence. Let's clear up some common myths. Myth: people with schizophrenia are violent. Fact: most are not. They're far more likely to be victims of violence than to commit it. Myth: schizophrenia means having split personalities. Fact: it affects reality perception, not identity. Myth: it's hopeless. Fact: many people live stable, productive lives with treatment and support. Living with schizophrenia means learning to separate the voice of the illness from your true self. It takes patience, structure, and a strong support system. But recovery is possible. It's about rebuilding trust with your own mind. And for those supporting someone with schizophrenia, lead with compassion, not fear. Listen. Encourage treatment. Celebrate small victories. Because behind every diagnosis is a human being, one with dreams, feelings, and strength you might not see at first glance. Schizophrenia isn't the end of a life. It's the beginning of learning to live differently. It's a journey that takes courage every single day. And if you or someone you love is living with it, remember this: you are not broken. You are not alone. Understanding brings light, and light makes healing possible.